Good evening, everyone. All right. I hope you all enjoyed your snacks and had a chance to play some games and learn some Social Security trivia that you can share with your friends. It's a it's a party pleaser for sure. Good evening. I'm Martha Cranley. I'm the state director for AARP here in Wisconsin. And welcome to this important conversation about Social Security. AARP works with and for our members across the country and the state of Wisconsin to be a fierce defender of our neighbors on issues like protecting Social Security and Medicare, of course, safe streets, housing, and consumer protection. This town hall is the fifth in a series we have been conducting around the country that AARP is sponsoring jointly with the National Committee to Preserve Social Security and Medicare. We have already held discussions in Richmond, Virginia, Philadelphia, Lansing, Michigan, and Las Vegas, Nevada. Thank you to our colleagues at the National Committee for your terrific partnership. Sorry about that. All right. We believe it's especially important to be holding this conversation here in Milwaukee. Wisconsin has almost 1.3 million Social Security beneficiaries, including over 72,500 children. And something important that most people don't realize, Social Security benefits add $27.5 billion with a B each year to our state's economy. And here in Milwaukee County, there are over 165,000 Social Security beneficiaries. Some of you may be in this room. Remarkably, Social Security benefits contribute nearly $3 billion to our local economy. Mayor Cavalier Johnson would have liked to welcome you in person today, but his schedule did not permit it. However, he sent us the following video we'd like to share with you.
Hi, I'm Mayor Cavalier Johnson, and welcome to the III Shrine Center in beautiful Milwaukee. I want to thank all of you for attending this important event, both in person as well as virtually through the internet. For thousands of residents in Milwaukee, Social Security is a vital part of both their financial security and their independence. We often think of Social Security as a program that provides workers a reliable, though modest, income in retirement, and it is, but it's also so much more than that. For a young worker with average earnings, a spouse, and 2 children, Social Security protection is equivalent to a life insurance policy with a face value of $725,000. Tonight, you'll learn more about Social Security, and you'll be empowered to push back against the myths that we hear. I hope that you take the opportunity today to learn, to ask questions, and leave this event committed to advocating for this vital program. With your help, we can make sure that Social Security is not only here today, but here tomorrow. Thanks again for your interest and commitment to this vital program.
And now it's my pleasure to introduce to you my colleague and our moderator, David Bowen. David is the AARP Wisconsin's Associate State Director for Advocacy, where he has pushed for policy and engagement in AARP's mission to enhance the quality of life for all as we age. Prior to joining us at AARP, David was an elected official, including a Wisconsin State Representative from Milwaukee and a 10th District County Board Supervisor. When he was a member of the Board of Supervisors, David was the youngest member of that board and one of the youngest Black elected officials in the history of the Milwaukee metropolitan area. Please give a warm welcome to our moderator and my colleague, David Bowen.
Well, good evening, everybody. One more time, good evening, everybody. Awesome. We have a star-studded crowd here. I'm seeing so many folks from the community that are engaged, that are active on so many community issues, and I am thankful that you guys chose the time to come out tonight, fight through this cold a little bit, and welcome to Wisconsin for our folks that helped to put this event on just 2 days ago. I think it was 60 degrees. Some folks had shorts on, but it's a little bit different now. But it's all good. We're really glad that you guys came out tonight. First off, can we give another round of applause for Martha Cranley, State Director of AARP, Wisconsin? I'd like to begin by saying a few words about why we are here today. If you are participating in this town hall, you already know how important Social Security is, how important Social Security is to your lives, your families, your neighbors, and your community. But there are a few things about this program that you may not know. I would like to make sure that I introduce a brief message from President Joe Biden's Social Security Administrator, Khalil Kaziadi. There we go. I thought I had it in my head before and it just left. But let's play that video of that intro.
In 2023, an average of almost 67 million Americans per month are receiving a Social Security benefit. A total of about $1.4 trillion in benefits will be paid during the year. I know many are worried about the future of Social Security's finances, so let me clear up one misunderstanding. Social Security will be there for you, your children, and your grandchildren too. As stated in our latest trustees report, the combined trust funds are projected to become depleted in 2034 if Congress takes no action. This does not mean Social Security benefits would end in 2034. It means that if no action is taken, there would be sufficient continuing payroll contributions to pay 80% of scheduled benefits. Of course, we would rather have 100%, and the trustees recommend that Congress address the projected shortfalls in a timely fashion to phase in necessary changes. With timely legislative action, Social Security can continue to pay 100% of scheduled benefits. Thank you for taking time to be part of this town hall and educating your friends and family, especially younger generations, about the value of Social Security. Take care.
Awesome. Thanks again to the President of Joe Biden's administration and Secretary Kaziadi. We want to make sure that you guys understand that Social Security is not just a retirement program. It is intended and it is known as a contributory social insurance program to provide financial support for families after the loss of the family breadwinner through retirement, disability, or death. Every American worker contributes to this program with each and every paycheck through what are known as FICA taxes, or the Federal Insurance Contributions Act. To give you a better idea of why we are holding this forum, we play for you right now a short video about the Social Security Here Today, Here Tomorrow campaign.
Without Social Security, I couldn't pay my bills.
If it weren't for my Social Security benefits, I'd be out on the street. God for Social Security.
Social Security is going bankrupt.
Social Security won't be there when I need it.
Politicians are stealing from Social Security.
When should I claim benefits?
How much will my monthly benefit be?
What will my husband and children receive?
Can I collect Social Security if I'm still working?
For more information, visit socialsecurityheretoday.org.
Awesome. Before I introduce our panel, I want to make a few acknowledgments and go over some housekeeping items. First, on behalf of the National Committee and AARP Wisconsin, I'd like to express our greatest gratitude to our hosts, the Triple I Shrine Center, their staff. We could not have held this town hall without their help. Let's give them a round of applause, please. By the way, how was that food? Good, good. Next, I'd like to acknowledge and thank Elita Elizondo, who is the Public Affairs Specialist at the Social Security Administration. Is Elita in the building somewhere? Want to make sure I acknowledge her. She will be around, and other staff will be here to help answer any questions that you have about Social Security and get you signed up for a My Social Security account. She will also be here to answer questions we don't get to during this conversation. Next, I'd like to draw your attention to the cards that were left on your seats. Anybody see those? Perfect. Those cards will be used to write down your name and any questions that you'd like to ask the panel to be able to get your answers to your questions during the Q&A section. Just make sure you raise your hand, and National Committee or AARP staff that we have in the audience will go around and collect those cards. So just make sure you hold those cards up so our staff can get to them. Really appreciative of their time. We want to get to as many questions as time permits. To get to that portion, let's make sure we get a chance to introduce our amazing panel. Now, if these names sound like superheroes, you already know the correlation. First, we have Amos Besaw, who is a disability benefit supervisor with the Milwaukee County Aging and Disability Services. Amos, you want to do your introduction?
Sure, yep. This is time. Can you hear me?
Yeah.
Hello, yep, I'm Amos Besaw. I supervise our Disability Benefits Specialist Program, our Elder Benefits Specialist Program through Milwaukee County at the Department of Health and Human Services.
Awesome. Let's give a round of applause for Amos, please. Next, we want to make sure we introduce Carolyn Colvin, was President Obama's acting commissioner of Social Security during his administration. As Social Security Commissioner, Carolyn oversaw one of the largest agencies in the federal government, with more than 60,000 federal employees nationwide. During Carolyn's tenure, her agency paid out more than $800 billion with a B each year in monthly Social Security benefits to more than 60 million recipients. Carolyn, would like to do your introduction.
Thank you so much. I'm delighted to be here and want to thank all of you for coming out tonight. I love this program. It is a foundation of retirement security in the country. And I hope that when you leave, you will take the message.
Yep, go ahead and pick up that mic.
You will take the message to others in the community that this program is there for them and their families now and in the future.
Round of applause for Carolyn, please. And next, we want to make sure we introduce Max Richmond. He is the president and CEO of the National Committee to Preserve Social Security and Medicare. One of the nation's leading advocates for Social Security and Medicare, Max is a prominent expert on senior issues and a former staff director of the U.S. Senate Special Committee on Aging. Max.
Great, thank you. Thank you very much, and thank you all for coming. For those of you who aren't familiar with our organization, the National Committee to Preserve Social Security and Medicare was founded about 40 years ago by a former congressman by the name of James Roosevelt. And he had retired from the Congress representing a district in California. He wanted to preserve what he felt was his father's greatest legacy, and his father was President Roosevelt. So he created the organization out of concern of the future of Social Security, and we've been working at protecting, preserving, and improving the program ever since. I've been the CEO and president since 2012, and it's an honor to be here with you tonight.
Thank you so much, Max. Before we get into the core of these questions, I want to make sure I keep building on your history and your career connecting to Social Security. And we know that Social Security is a foundation piece of policy that has impacted our country, helping to sustain the lives of so many. Talk to us about what brings you and connects you to the work of making sure that Social Security is continuing to make that impact. Anybody can. We'll start with Max.
So I wanted to, if you could put up that picture. Can you see that? Well, while we're waiting, I wanted to say that in this program, we're going to be talking about the value. Let me know when the picture's up. It's up? Okay. You see the picture in front of you? That was at the White House yesterday afternoon. The President Biden announced a series of measures, mostly in the Department of Labor, to protect retirement security. And I'm in that picture along with Joanne Jenkins, and I think all the people at AARP know who Joanne Jenkins is. She's the CEO of AARP. Not only was she there, but she introduced the president. That's really a big deal. And I asked her to take a picture afterwards, and we talked a little bit. And she said that it was her understanding that the Congress wouldn't act on any changes to Social Security this year. And that's correct. But what we're doing is, Carolyn and I have been all over the country educating the public about the value of Social Security, especially in communities of color, and talking about the misunderstandings about the program, the myths about the program. And the reason that's important is those myths undermine the support for the program. And that's what I'm going to talk about at my part of this presentation.
Awesome. Thank you, Max. Carolyn, would you like to give us some insight of?
Well, I first became involved with Social Security as a student. I worked for Commissioner Ball. And when I went into federal government, I had the honor of being appointed first by President Clinton and served in 2 roles there. I had retired from government and was asked by the Obama administration to come back. And my reason is very personal, that it has helped my family and me in so many ways. I'm very active in my community, and although I've been retired since 2017, I spend most of my days helping people who don't know the benefits that they're entitled to and whose lives are made better because of the Social Security program. So I'm very committed. And now as a volunteer, I've been working with Max to go around the country and to try to inform as many people as we can. And I ask people in the audience always, please take it upon yourself to talk to some other people and make sure that they understand the benefits to which they're entitled. I'm amazed with as much information as we put out there that there are so many people who are eligible, who are not receiving the full benefits that will make their lives better.
Thank you for that insight, Carolyn. Yeah, we can round of applause for that, please.
Hello, and I'm going to talk about some of the main core programs that Social Security has, and then tie in how Milwaukee County can help some of the residents here understand those programs, apply for the programs, and how to navigate the complicated system that is Social Security.
Awesome. Thank you, Amos. Let's round of applause at you. So, Amos, I want to go back to you and talk about how we see press reports that unless Congress can reach an agreement on a short-term spending bill, the federal government will shut down after November 17th. A lot of people will be worried about what this means for their Social Security benefits. Can you please tell us and explain how the Social Security Administration will handle a government shutdown and the impacts it will have on seniors, especially if it lasts a long time?
Yeah, no problem. I know that's a big concern for a lot of people, obviously, with the government shutdown that's impending, they say. Social Security benefits will still be paid, so people will still get their checks. That'll continue for the foreseeable future, so there's no ending to the Social Security system. I'm not sure exactly what they have in their whole funding resource, but it's definitely plenty of money to keep the funding going.
Well, one of the things that happens when we have a shutdown is that essential employees still have to work. They will not get paid during the period, but when the government resolves this issue, they get their back pay. So I have never, in the history of Social Security, have we ever missed sending out payments, even in natural disasters. So people will continue to receive their benefits.
Awesome. Thank you so much for that insight. Carolyn, can I jump back to you? And we've talked about how you've spent many years working on Social Security issues, both at the agency and individually. Can you share with us some of the most frequent questions that you get from ordinary people?
Yes, thank you. One of the questions I receive is, when should I take my benefit? And I tell them that's a very personal decision. It depends upon whether they need the money immediately. But I remind them that if they take it early, they're going to have a permanent decrease. People who take it at 62, which is the earliest they can take it, experience about a 30% reduction in the benefit for the rest of their lives. I also receive the question about spousal benefits. Many people don't understand that if an individual is married and divorces, that they are still entitled to benefit unless they remarry after a certain before a certain age. So it's usually, when do I take it? How can I know how much I will get at various intervals? I always refer them to my Social Security account. They really should set up one. How many of you in this audience have established a My Social Security account? Great, that's wonderful. It tells you how much you can earn or you will receive. It answers all the different questions that you have. Much of what we will share with you tonight is on the website. So if you're not enrolled, I would encourage you to do that.
Awesome. Thank you, Carolyn. Max, I want to jump to you and kind of build on this conversation that we're having. And you've been at dozens of town halls like this around the country. Everywhere you go, you hear from people how much they depend on Social Security to help them cover living expenses and pay their bills. We were just on WNOV radio. The host, Keith Paris, talked about how his father passed away, and he was able to use those benefits to help him go to a great high school and great college. But if Congress doesn't act and protect Social Security in the next 10 years, then people could see their Social Security cut by 20%. That's about $4,000 a year on average. What do you think it will take for Congress to get past the partisanship and produce real solutions to protect Social Security for the long term?
One word: courage. And there's not a whole lot of that in Washington these days, but it will take courage. But You're right. We were on the radio. We talked about what I'm going to talk about now, some of the myths about the program, because you've probably heard many of them. And also I wanted, Peggy Hardy, where are you? Peggy? You out there? There you are. Peggy is here. She came up and told me she's here because she heard us on the radio. So thank you for coming. I think you probably heard many of these things, and I am going to answer your question.
Sure.
Social Security is broke. You hear that? It's bankrupt, right? You're nodding, so you hear that, right? That's not true. Social Security has some long-range solvency problems, and the Congress needs to fix that. And to your question, the program, this is not Max Richmond or Carolyn Colvin saying it, the trustees of Social Security issue a report every spring. The program the trust fund itself will run out of money in 10 years, 10 or 11 years. And that needs to be addressed. And I think Congress can do that. The last time the Congress dealt with this solvency, it was 6 months that it had to fix the long-range solvency of Social Security. We don't want to wait till 2033. That needs to be done much sooner. But that is a very different proposition than people hearing it's broke, it's gone, it's not going to be there. That would be very, very hard to fix. And I think it's important to make that distinction. The other thing you probably have heard is that there's no money there, right? No money, just a bunch of IOUs. That is not true. Social Security, by design, has built up a trust fund. It's almost $3 trillion. More money that is paid in most years than is paid out in benefits is put into the trust fund. It's like a savings account that earns interest. And that money is going to be drawn down over the next 10 years so that in 2033 or 2034, the only money coming in to pay benefits will be from the payroll tax. But that money is not just a bunch of IOUs. It's, some people will say, it's invested in government bonds, backed by the full faith and credit of the U.S. government. And those bonds are rolled over regularly. And here's one way I'd like you to look at it. At the beginning of COVID, when we had a lot of unemployment, less money came into the program through the payroll tax than was needed to pay benefits. But everybody got their benefits, right? Nobody missed a Social Security check. Why? The trust fund was tapped, and that money was used to make up the difference between the payroll tax and what was needed to pay out in benefits. And in fact, the size of the trust fund actually grew because their interest was paid on these bonds. A couple of other quick things. Social Security, and we talked about this on the radio, if you remember, it's not an entitlement. You hear people talk about entitlement reform. It's not entitlement. You know, you're nodding. It's an earned benefit, right? An earned benefit. You pay your FICA tax with every paycheck. You're earning this benefit. It is not welfare. It's money that you have put into the program to take care of your needs when you retire. And that, the last a couple of points on that, it's not just for seniors. You know, FICA, how many of you know what FICA stands for? Sounds good. Federal Insurance Contribution Act, FICA. It funds old age survivor and disability programs. This is a program for families. A third of Social Security benefits go to non-retired workers, spouses, survivors, children. Millions of children get by in life because Social Security is there for them. And as an example, and please, we're here to talk to you, but we want you to talk to your friends. If you are a young worker, a wage earner with a spouse and 2 children, you have right now almost $2 million in value of life and disability insurance if something bad happens in the family. A lot of people don't know that. And Carolyn talks about helping people. She decided as she was leaving government to give everybody her telephone number. People call her from all over the country that have questions. I've never heard of a government official, let alone the head of one of the largest departments in government, giving out their cell phone number. So God bless you, Carolyn. The last thing, two myths that I think really bother me, and I just hate it when especially when members of Congress get into talking about it. Undocumented workers are stealing our Social Security. You hear that? That's not true. Undocumented workers are not stealing Social Security. In fact, just the opposite is true. There are many cases where undocumented workers somehow get a hold of a Social Security number in order to get a job. It's not a real number, but they have payroll taxes withheld, FICA tax, their employer withholds tax, but when it's time to start collecting, they can't collect because they don't have a real number. And a study was done not that long ago of all of the millions and millions of dollars that were paid into the program by undocumented workers that has never been collected. So don't get hung up on the rhetoric about undocumented workers stealing Social Security. It's not true. Lastly, and I hear it a lot, and I know members of Congress hear it a lot, members of Congress don't pay Social Security. That's not true. Members of Congress pay Social Security just like every other worker does. So that's my spiel. All right?
Awesome. Thank you, Max.
Thank you very much.
Applause that too. So I'm curious. I want to see how many people in the room have been working for how long and how long they've paid into this program. If you have been working for more than 10 years, raise your hand. Okay, I get to raise my hand with you. Okay, if you've been working more than 20 years, raise your hand. My hand goes down. I got 2 more years to hit the 20-year mark. Okay, if you've been working more than 30 years, oh bless your heart. Oh bless your heart. Look at you. Okay, we got to have some 40-year people in here. 40 years you've been working. Okay, now this is getting unfair, okay? That's a lot of time. Anybody touching 50? Get out of here. You guys look way too young talking about working 50 years.
You know, you're going to date some of us here. Be careful.
Which is not a bad thing. But it shows the impact that this program has made and how it really is important, especially for folks in my generation, as we see so many folks that have benefited from this program, and we want to benefit from that program too. And these myths are getting in the way of everybody understanding that this program will be around and will be able to support even us. Let's talk about the world of what it would look like if we didn't have Social Security. Can we do that?
Well, I'd like to talk about the importance of Social Security to the African American community and to communities of color, because many individuals in those communities believe that Social Security does not benefit them. For instance, in the African American community, where you have a higher disability rate than with other populations, and you have a higher death rate, individuals say, well, they're not going to benefit from it. But as Max mentioned, it's not just a retirement program, it's a comprehensive insurance program. So even though a worker may become disabled, they're eligible for the disability benefit, and not just them, but their spouse and their children receive a benefit. For those who experience a premature death in our community, their survivors, again, will receive survivor's benefit. My son passed at 34, 35, and had 4 children. Social Security helped to educate them. I have a brother who became disabled as a youngster and is now 72, thank goodness, and disability has allowed him to live independently. So that misunderstanding hurts the program and the support that we need people to give. For many people in our community, they have low wages and They're not able to accumulate other sources for retirement because, you know, Social Security was never intended to be the sole source of retirement. But because of the progressive formula that Social Security uses in determining benefits, those low wage earners get a higher percentage of their benefit than for the higher wage earners. This then means that it can keep many individuals out of poverty because they have Social Security. Some individuals, Social Security is the only benefit that they receive, and without Social Security, they would have no source of income. So it's important for people to really understand the program. The spousal benefit, the fact that if you've been married for 10 years and you divorce, you are still eligible for that benefit even if the spouse remarries. So those are the kinds of things that we are trying to make sure that people understand. And for people of color, Social Security is critically important because they would not be able to survive without that complementing some of the other benefits they receive because the benefits are so low in other areas where they have low wages or don't have pension plans, etc. So that's my mission, to try to get that information out there.
So thank you, Carolyn. I'm so glad you explained all that. You know, David, when you were asking how many years people worked, it got me to thinking of one of the arguments that I hear a lot when people talk about how do we address the solvency, the fact that if Congress doesn't do anything, in 10 years, benefits will be cut pretty dramatically, 20%. I'm convinced we'll never get to that point. But one of the arguments I hear a lot is we should raise the retirement age. You hear that? We should raise the retirement age. First of all, the retirement age went up already from 65 to 67. It's going to be 60 gradually. It's going to be 67 for everybody in a couple more years. And when I hear that argument, it's usually part of the thinking is, well, people are living longer, right? And speaking for myself, I think it's a good thing people are living longer. But the fact that people are living longer doesn't mean they can work longer.
That's right.
There are an awful lot of jobs where you can't keep working and working. You're working in a factory, you're working on an assembly line and on a farm. You can't just keep working. You get tired, right? So that is, I think it's a phony argument that we should raise the retirement age because people are living longer. Where are all these jobs for older people? I don't see them. So it's, you know, and I'm talking about this to you because you go to town hall meetings that members of Congress, challengers, incumbents have around the country. And David, you know, you've been in politics. You need to ask the questions. You need to ask, what is your position on the future of Social Security, on Medicare? And I meet a lot of people running for office, and I've been involved in many, many campaigns for the House and the Senate, many of them, hundreds. And when I meet someone new and I tell them who I am and what I do, they always say, oh, you're with your work on Social Security. I'm for that. That is not good enough. Saying I'm for that is not good enough. You need to ask when you go to town hall meetings for your people running for office, for especially federal office, where are you on raising the retirement age? Where are you on cutting the cost of living adjustment? That's another big thing. We need to cut the cost of living adjustment. It's too generous, even though the COLA was zero for 3 out of the last 11 or 12 years. So you need to be armed with the information that hopefully you're getting here tonight and can ask the right questions and decide if you want to support the people you're meeting that are running for office.
Awesome. Thank you so much, Max. Amos, I want to pull you back into this conversation as we talk about, you work with folks on the grassroots level. You're working directly with folks that need access to help, and you're helping them navigate that. What would you see if a program like Social Security would just go away?
Yeah, if Social Security went away, it would definitely be devastating to the people in the community. I supervise our disability benefits specialist program and our elder benefits specialist, and they directly help people apply for SSDI, SSI benefits. Each of those has a lot different eligibility criteria. The Social Security Disability Insurance Program, people have to have worked and paid in taxes, and typically to be fully insured, it's 10 years of work, 4 credits a year is fully insured status. So if someone has a condition and they're not able to work, they can apply for that benefit, and then that allows them to remain independent, living on their own. Our benefit specialists can help people do the actual application through Social Security, which is a huge benefit. They also can help do the appeal process. The applications are not fast and they're not easy. Typically, what we're seeing right now is about 9 to 12 months before someone actually gets a decision. So it's a very long process. Social Security sends out a lot of paperwork for people to fill out. That can be very complicated, confusing for people. They're not able to physically fill it out, or they don't have the mental capacity possibly to fill it out. So we're able to help them do that paperwork and get good information submitted to Social Security in hopes that they would be approved faster. Obviously, it doesn't happen in every case. So then in that situation, our benefits specialists can help them do the appeal process. Specifically to Milwaukee County, our benefits specialists help people between 18 and 59, and there's no charge for our service. All you have to do is contact the Aging and Disability Resource Center and ask for a benefits specialist. We also have an elder benefits specialist, and they help people that are 60 and over in Milwaukee County. There's also no charge for that service either. They do a lot of Medicare counseling, so they'll explain the different parts of Medicare, what they cover. They can help them do Medicare appeals. So if they get denied a service item, a medication, they can help them look at that. They also help look at the Medicare Plan Finder. So if someone needs to enroll into a Part D plan, they'll help them look at that. So it's a really great resource to the County of Milwaukee that we have our benefits specialists available. They also will help with kind of not side benefits, but like if someone's found disabled, the person's spouse can get a benefit sometimes off of that record. The children can sometimes get a benefit off of that record. So it also helps the whole family in general, basically, to be able to remain independent and not rely on other assistance. So it's definitely a very important program. Those are some of the core services that our DBS program helps with and our elder benefit specialists, but they do help with a lot of other related things that Social Security does. So there's continuing disability reviews. So people that are on disability, they'll eventually get reviewed for their disability at some point, and that kind of depends on what they're found disabled from. But our benefit specialists can help them navigate that process. A lot of people also may be on disability and they want to work and have more income coming in because sometimes the benefit's not enough. Sometimes stuff isn't reported correctly to Social Security. They get misinformation or bad information, or they don't get the information, and that can lead them to an overpayment. And our benefit specialists can look into those overpayments and if they should have happened and whose responsibility that is. And they can also help people pick out Medicare Part D plans. So there's a whole host of things that we help with. So if there's ever any specific questions, definitely call the ADRC. I do have a resource table on the back right-hand corner with a bunch of information for us in there.
Awesome. Thank you, Amos. Can I jump into the questions that we have from the crowd? One in particular says, if I have no life insurance, will Social Security help with the burial, and how much is given? Any idea on that one?
The only burial coverage that Social Security provides is to the spouse, and it's only about $250. So that's not very much. Now, there may be survivor benefits that will start up, but that's not going to be an immediate lump sum. So I don't know what resource might be available.
If I can chime in, the Milwaukee County actually has a burial assistance program, which also can provide some assistance. So there's actually also information on the back table about that. It's not a huge benefit, but sometimes people can be eligible for the Wisconsin Funeral Crematory and Assistance Program through the state of Wisconsin. That offers, if they're eligible or have the right type of Medicaid, they can get $1,500 towards their funeral service costs. And the county service is about $490 $400 about. But we also contract and work with funeral homes, and our burial worker has a lot of direct contacts with the different funeral providers. And he does a really great job on helping lower the costs initially to stay with under the capacities that we have. And then that also gets them additional funding for the burial.
And let's build on that. How do you collect spouse Social Security, or can you, if you receive Social Security on your own?
I'm sorry, what's the question again?
How do you collect spouse Social Security, or if you can receive Social Security, if you do receive Social Security on your own?
Well, it's never automatic. You would have to make an application. You can do it online, or you can go into a local office. You can also call the 800 number, but you do have to file for the benefits that Social Security offers, not just survivors, but disability and retirement also.
Then Max, can I have you give some insight? Talk about the COLA. Is it always automatic, and why does it vary so much?
You're talking about the COLA?
Cost of living
You all know
adjustment.
what a COLA is, right? Cost of living adjustment. It is really one of the most unique and really beautiful features of Social Security. Unlike any other pension you might have, it has a cost of living adjustment that's built in. It isn't perfect. It doesn't always work the way I think it should, but in most years, the increase is 2 or 3%, sometimes a little more. The last couple of years, because we had such high inflation, the COLA was really large. It was 7 or 8%, I think, in the last couple of years. But that does not, in my opinion, that does not make up for the fact that the COLA is, the formula for determining the COLA, the cost of living adjustment, is flawed. And yes, you got a great COLA last year and the year before, but as I said a minute ago, 3 out of the last 11 years, the COLA was 0. And when I go to town hall meetings, and have in the past, and I say, well, it's announced usually in October, isn't it, Carolyn? Yeah. And I say, well, your COLA this year, it's been just announced, next year your COLA is going to be 0 because the government decided your cost of living didn't go up. People laugh. Because that's not, they know that's not true. They know their cost of living went up. Here's the problem. The formula that's used to determine the cost of living adjustment looks at how inflation affects a working person. It's called the Consumer Price Index for the wage earner, for urban wage earners and clerical workers. That's a whole different proposition than how inflation is affecting an older person. And what needs to happen is the formula should be changed, has to be done by law, so that it measures those goods and services that a senior relies on in order to determine what the COLA is. And that's not the way it's done now. And if it were done that way, the COLA would be a little bit more, not a lot, but a little bit more each year. But keep in mind, the COLA is cumulative. So it's like interest in a savings account. It adds on each year over time. It makes a big difference. Now, the last thing I want to say about this, I was, as you mentioned, David, I was staff director of the U.S. Senate Special Committee on Aging back in the mid and late 80s. And we tried to get this changed. We tried to get the law changed so that you could have something called the Consumer Price Index for the elderly that measures inflation for an older person for the purpose of the COLA. And we couldn't get it done. There wasn't enough support. So it's been put into law as an experiment. It's never applied, but it is put in. So year after year, we see what this is. So that was 36 years ago that I got it and as a staff director with the Congress to put it in as an experiment. So I'm hoping that it finally, I don't think I'm going to be here for another 36 years to get it into law.
Max, I'm 36 years old.
What's that?
I'm 36 years old.
Okay. But it needs to happen, and the sooner the better, because it will affect your Social Security check year after year after year.
Well, that's good. That's good to know. Thank you so much, Max. Let's go ahead and switch gears and talk about how Social Security affects children. Can a parent with an autistic child receive Social Security? And just give us an explanation of how the dynamics of children are connected to Social Security.
I'm sorry, but I don't really know the answer to that. Now, many children receive SSI, which is state funded, but we administer it, and that covers children who have disabilities. I don't know about.
Social Security person would be the best person.
Yeah, I don't know.
I know some of the rules are a little bit different for children. So like when an adult 18 or over is applying for disability, they're looking at how is this person's disabling condition affecting their ability to earn income. They don't use that same standard with children. They're more looking at marked activities of daily living. So is this person able to follow and understand directions, like in the case of autism? Are they able to regulate water temperature? Things like that. So it's a different standard for children versus adults.
Awesome. We can build onto that because somebody has a question about disability benefits. How does someone qualify for disability benefits? If I have applied and I'm waiting for an answer, can I apply for Social Security?
Do you mind reading that one more time? I didn't catch the whole question.
How does someone qualify for disability benefits? If I have applied for those benefits and I'm waiting for an answer, can I apply for Social Security?
If you have already applied for disability, it's obviously a long process. It's not real fast or easy to go through. The most important thing, I think, is to submit the best medical information. You want to have all the conditions, all the doctors, all the medications that you take. If any doctors that you see are willing to fill out like a supportive statement or some type of functional capacity form on what you're able to do, that definitely helps Social Security make a better decision.
But I think I heard a different question. The question was, if I've applied for disability and I'm still waiting, can I then apply for Social Security? Mm-hmm. And the answer is yes, if you've reached the Social Security retirement age, because in fact, if you were receiving disability, when you reach the full retirement age eligibility, it would convert from disability to Social Security anyway. So if you have been waiting and you have reached the age where you're now eligible for Social Security, you can apply for Social Security. And you would not have to then go through the process of applying for disability.
Awesome. And we're talking about the qualification age for Social Security. How early should you file before you start Social Security?
I indicated to you that's the question I get, and it's really personal. If you file at the early retirement age, you're going to incur a permanent cut. If you file at 62 and your permanent retirement is 67, you're going to be looking at almost a 30% cut for the remainder of the time that you receive it. So what I say to people is, if you don't need it and absolutely can make it, then don't take it at 62. If you are still working, because you know it's going to be reduced by $1 for every $2 that you earn if you're not at full retirement age. So there are a lot of factors. One of the things I suggest is that you use the online calculator, or you go into the office and they can tell you what you would get at early retirement and then what you would get at full retirement, and you can make that decision with the information that you have.
So the other thing you can do is you can ask Carolyn for her cell phone number.
I'm not a technician, but I will get you connected with the right person.
Awesome. And then you also have your amazing AARP staff as well, right? We can help get you connected to.
And he was really kidding about that.
Yes. Not everybody call Carolyn, please. What year do you have to file to get Medicare?
You are supposed to file by age 65. It's suggested that you file 3 months prior to your 65th birthday. Again, if you don't file for Medicare and you don't have coverage through an employer, you get penalized, and that penalty is ongoing.
Okay. So just to be clear, if you have insurance, if you're employed and you have insurance through your employer, and then eventually you take Medicare, then you're not penalized. It's only if you don't have that insurance and you wait, and the longer you wait, the worse that penalty is.
Sure. What happens if I become sick or ill and have to retire early? Will I still receive my full benefits?
You will not receive your full benefits. If you file prior to age 67, which is what it is right now, you're going to have a permanent reduction.
That's right. So stay healthy, eat right.
Unless you are at a point where you're determined to be disabled and unable to do any work, and that's a very challenging definition, then you could apply for disability, but not Social Security.
And that's an important point that you bring up, because Social Security, I think their recent figure was 1 out of 4 people will become disabled before retirement age. So that's like 25% of people. So that's a pretty high number, higher than what I think people think.
Awesome. We're winding down to our last 10 minutes. Oh, the last question?
Yeah. Now, if a person they become disabled, but let's say they 56, they have to apply for disability instead of
Social Security.
Yes.
Correct.
Yep.
Okay. Now, is the benefit the same or is it a different dynamic?
It's the same, because when you reach full retirement age, you simply move out of the disability box into the retirement box. So it's the same.
Gotcha. No worries. Can Social Security be garnished?
Well, when you get disability, your benefit is based on the years that you've worked, the quarters that you paid in. So that's not going to change if you're still on disability. So you're not earning any additional years, and your benefit is calculated based on that. If you want more information, I would suggest again that you talk to one of the specialists who are in the back who can give you more concrete information.
Awesome. And the next question was, can Social Security income be garnished?
Do we have a Social Security rep here in the room? Any staffers from Social Security? I'm sorry, I don't know the answer to that. I think not, but I'm not sure.
Yeah, I would think not too, but we can double check.
It can be.
It can be. Okay. Okay. So for student loans or back taxes, Social Security can be garnished. Max, I have a question for you. What is your opinion about the declining fertility rate on Social Security?
Declining what?
The declining fertility rate.
We need more babies.
Yeah, Carolyn said it. We need more babies. The ratio, I mean, what you're talking about is the ratio of workers to retirees. And that is an argument that is often raised of why we are getting into the solvency predicament, because there are fewer people working. I don't remember the numbers, but I think it's either 3 to 1 or 2 to 1 now. And it was much higher, 10, 11 to workers to each retiree. So, but that's not an insurmountable problem. That's not the reason to cut benefits, certainly. It's a reason to look at, and I didn't make this point. I'm going to make it to you all because I think it's really important. We're not advocating any particular changes in law at these forums, but one of the items that's looked at in order to extend the solvency is not raise the age for retirement. We can't do anything about the ratio. It is what it is, workers to retirees. But there is a cap on wages subject to the payroll tax. You all know that, right? It changes a little bit every year. This year, it's I think $160,200, or right around $160,000 in wages. After that, no more payroll tax. Why? Some groups support eliminating that cap altogether, so you pay payroll tax on your wages, whatever they are. Others have supported keeping the cap at what it is. It goes up, as I said, a little bit every year, but then start collecting payroll taxes at maybe 400,000 or 300,000. So you bring more revenue into the program in a way that some believe is fair. And a lot of people, you know, I've been to town hall meetings and I mentioned this. A lot of people don't even realize that there's a cap on wages, subject to the payroll tax, because they've never reached that cap and they just pay Social Security tax on their wages. How many of you know there's a cap? Well, this is a well-informed group. And how many of
Smart
you think
people in
that should
Wisconsin.
be, how many of you think that should be changed? All right. Well, that's a good response. Thank you.
Awesome. We're under 5 minutes now, and I want to be able to leave some time for you to give us a closing statement, but then also kind of get your insight on these last two questions that I'm combining. So the first question is, why is survivor support for widows limited to 2-year timeframes? Anybody know?
I say that again.
Why is the survivor support for widows limited to 2-year timeframes?
I don't know that that's correct.
I don't think that's correct.
Gotcha. So the answer would be likely that 2-year timeframe possibly does not exist.
Are you saying that a widow can only receive a survivor's benefit for 2 years? That's not accurate.
Gotcha. Yeah. So somebody must be misinformed, and now they know because of you guys that that's not a limit. And then someone said, what are the chances means testing for Social Security benefits will be enacted? Means testing.
Means
I've never heard of
testing.
that.
Carolyn says it's a bad thing. What means testing, and you hear that a lot in discussions in Washington, is if you reach retirement age and you've made a lot of money, you shouldn't get your Social Security, or you should get less Social Security, right? That's what means testing is. Reducing the benefits if you've done well. How is that? How in the world is that going to encourage people to support Social Security? If I do well, I'm not going to get my Social Security. Means tested programs are welfare programs. And we do not want to turn Social Security into a welfare program. I think you agree with that, right? There is broad support for Social Security. Democrats, Republicans, Independents, over 90% support the program and support improving the program. People do not support welfare programs like that. So, you know, I have never met a Social Security beneficiary who's ashamed to be on Social Security. Never. And I have never met a person on welfare that would be proud to be on welfare. So we do not want to change Social Security from an earned benefit into a welfare program, and that's what means testing, in my mind, would do.
Gotcha. So we have about 90 seconds left, and I want to give all three of you guys 30 seconds for your closing statements, but also inform us about how we can be better advocates for Social Security.
I'd like to give my 30 seconds to Max.
Carolyn passed me a note, and I read her note, and she said we need to get younger people involved. Younger people like you, David. You said you're 36 years old?
36, yeah.
You don't look 36. And this man, I read his bio. He has accomplished an awful lot for anybody, but especially someone your age. So what Carolyn's note said, we need to get younger people involved in this debate. And that is absolutely true. And that's where you come in, is to talk about the things that you have listened to at this forum, especially to younger people. They are the most cynical about the program. They're the ones that believe it won't be there in the future. Why am I paying Social Security? It won't be there when I retire. And as I went through all these myths, that is wrong. But they are the most cynical. I have seen polls that younger people think they're more likely to see a UFO than to get a Social Security check, more likely to see Bigfoot than to get a Social Security check. And that is wrong. And you can help educate the younger people about this subject.
Let me just
Very good
mention
point.
one thing. When I worked at Social Security, I had a group of young people come together. And one of the things that I talked to them about and got them excited working with us was that you have parents that I know you love and they have taken care of you as a youngster. If Social Security were not there for them, what would you do about that? And they said, of course, we take them in, we'd care for them. So I said, but Social Security allows you not to have to do that. And they began to think about that. And then I asked them how many of them had lost a parent before they finished school. And I'd say half the room raised their hand. I said, are you aware that your parent, your surviving parent, received the benefit from your deceased parent that helped to care for you? So it's a matter of educating them so that they understand, and Social Security impacts them right now.
Amos.
And I would just add in, obviously, Social Security is a really, really important aspect for all of us. The other thing I would say is create a My Social Security account, review your earnings information on there, make sure everything's correct, and then you can get a look at what your benefit could be when you retire, and then contact Social Security if you want to find out more information about the best time for you to retire.
Awesome. Can we make some noise for our panel, please? Lastly, I want to make sure, first off, just thanking you guys for traveling here, being here with us. And the last part about being better advocates is something that I'm going to put on all of us. As you look to your left and look to the right of the folks at your table, we are the ones to be able to step up and ensure that this program continues, and ensure that the same idea of why this program was created, connected to the New Deal, connected to the Great Society, and the idea that this country could have a safety net that would make sure that every hardworking person could invest in this program and have it invest back into them. That is on us to be able to advocate for. So we have some amazing staff from the AARP Wisconsin team here in the room. So please get to know us, and please make sure that you are engaged. I want to make sure I pass it back to Martha Cranley, State Director of AARP Wisconsin. Thank you.
I also want to thank the panelists. That was amazing and informative, and I feel really fired up now to advocate for Social Security and Medicare. So I really appreciate it. And we have some, so thank you again. One more round for these guys. That was amazing. So my colleague Martin and I are up here to do the fun part, which is to pull some raffle tickets for the prizes. So does everybody have their red ticket? All right. All right, so the first gift card goes to ticket number 4725947. All right, come on up.
What did she win? Oh, that's nice.
Oh,
That's nice.
oh, and what does she win? Oh, it's a $50 gift card for people who want to. All right. Woo, exciting. All right, next one. 4725959.
Somebody went
4725959.
good.
Okay,
Yeah, that's nice.
moving along. All right. This one, oh, there's a theme. 4725979. All right.
Okay.